Hello and welcome to this video, which will focus on the care and management of your wound after a total knee replacement. Please follow these instructions carefully. When you wake up from surgery, you will notice a large dressing wrapped around your knee. Beneath the bandage will be a gauze or wool padding, with an adhesive dressing on your skin overlying the incision. Usually, the skin glue will also be applied to help seal the wound. After 24 to 48 hours, the compression bandage together with the wool padding will be removed, exposing the adhesive dressing. Your incision is on the front of your knee, approximately 20 centimeters long if you are having a total knee replacement, but variable in length, depending on other knee replacement procedures. Your surgeon will advise you on whether you have dissolvable stitches or clips. You may also be given spare dressings, just in case you need to redress your wound at home. If you require to change the dressing, please follow these steps. Wash your hands with soap and water and dry as needed. Take the old dressing carefully. Never touch the healing wound. Do not wash the wound or apply anything on it, such as ointments or creams. If there are any steri strips or mesh dressing over the wound, do not touch them. If there are any visible stitches, do not touch or pull it. Wash your hands again before applying the new dressing, making sure that you do not touch the adhesive part, and press on the edges to make a good seal. Common symptoms after your surgery: expect to see some swelling and bruising on your thigh and around the knee, or in the lower leg. These symptoms are common and will eventually subside through time. You can manage these symptoms with elevation and ice packs. Additionally, your knee will feel warm to touch. This is normal. You will also experience some numbness around the incision site on the outside region of your leg, just below the knee. The numb area tends to become smaller through time. A spotty drainage that can be red or clear in color is also normal, which can last from 1 to 5 days. We would advise you to seek medical attention if you notice these symptoms: a temperature of 38.6 degrees Celsius or higher, accompanied by chills or shaking; a rapid increase in drainage, lasting more than 5 days after the surgery, or a drainage that is foul-smelling or yellow in color; a severe swelling or pain that does not improve; blisters around your wound; severe pain in the calf muscle, shortness of breath, and/or chest pain. This can indicate deep vein thrombosis. Please contact the ward that you were discharged from. 14 days after your surgery, you will be seen by a practice nurse or a physiotherapist for a wound check. The dressing should be removed at this stage. The nurse will do some assessments and would do some recommendations according to the status of your wound. A new dressing may be applied if the nurse deemed that the wound would benefit from being covered for a couple of more days. A swab can be taken for examination if the wound is moist, and your wound will be covered again with a dressing until the condition improves or until results arrive. Diet after your surgery. You may feel a loss of appetite after your operation. This is normal because of the medications you had in the hospital. However, it is important to eat a well-balanced and healthy diet that includes a good amount of protein and fiber. A well-hydrated body is also recommended. You can do this by drinking 1.5 to 2 liters of water a day unless you are told otherwise. Furthermore, to avoid constipation, it is important to eat a high-fiber diet such as wholemeal bread, whole grain foods and cereals, and a sufficient amount of fruits and vegetables. Thank you for taking time watching this video.